guys, this is the Clinical Breakroom podcast. We are both nurses, so we just decided to start this podcast together. And we didn't really see there's a whole lot of nursing podcasts out there. So we really wanted to use this podcast to kind of elevate the attention to nursing in general and kind of give insight to anyone who's aspiring to be a nurse. So Lexi and I, we're going to be the hosts for this, and we're going to have guests on all the time. But this one's just going to be us two, kind of give you a background of who we are. As I said, we're both nurses, and we kind of both done completely different things with our career, which kind of shows how good nursing really is. But we're going to talk about this podcast is going to go over the journey of how to become a nurse and what it really takes. And we're both going to kind of give our stories of how we ended up being nurses. And of course, we actually met in nursing school, so we're going to talk about that, how that happened, and everything. So, but just to give a little background about myself, so my name is Kirkpatrick. I am the founder of Tactile VR, so it's presenting this podcast. But I've always pretty much been around nursing my entire life. I have a family full of nurses, and they, I would say, probably persuaded me to become a nurse. At first, when I was going through high school, I thought I was going to do something in science, but I thought I was going to do forensic pathology, which was still, I still think that's really cool, but ended up for some reason getting into nursing right after I got out of high school, and played football for college football for a year. Started in a BSN program, which we can talk about that difference between a BSN and ADN program because a lot of people don't really know. But played football for a year and then transferred back to an ADN program, which is back where we're from in Ohio. And if you guys don't know, ADN, Associate's Degree of Nursing, and it's a community college. So 2 to 3 year school, went back, finished my schooling there, and that's where, of course, I met Lexi here. So I'll go ahead and let Lexi talk about her background and how she ended up getting into nursing.
Hi, my name is Lexi Kirkpatrick. I'm a registered nurse and I started in high school. I went to the Career Center and I got my STNA before I graduated high school. And that led me to working at a nursing home and I worked with a bunch of old people and it was wonderful. And I actually wanted to do physical therapy before I got into nursing. And I started taking like intro to PT and things like that, and it was super boring. And I'm like, oh my gosh, help me. I need something more exciting than like doing this. And so yeah, so I transitioned into nursing school and I I loved it. It was just, where I knew I needed to be. And I did the ADM program and I graduated from the ADM program and then I got my BSN online while I was working as an RN. And I'm currently in school for my master's. I'm specializing in gerontology as a nurse practitioner and I work in wound care. So I work in an outpatient wound care clinic. It's a comprehensive head to toe, and then I also work in a diabetic foot and limb preservation center. So we do ankle below, lots of diabetic ulcers and all the fun things,
Gross.
lots of pseudomonas and smelly wounds. So that's where my heart is. And I get to see a lot of old people because, like, all
You
the
do
old
love your old
all the old
people.
folks come in and they have boo boos that we take care of. So
You're the boo boo crew.
yeah, we're the boo boo crew.
I guess I forgot to mention what I did. So I kind of talked about how we both kind of went directly different ways, or we went different ways completely in nursing. That you did wound care. You start out with doing home health as your first job as a nurse, and then I went into critical care like pretty much right away. I went into the emergency department and then quickly transitioned into the ICU. So we both, Lexi's never worked in a hospital, so that just shows you guys that if you're wanting to work as a nurse but you don't want to work in the hospital, it's definitely possible. Even if it's your first job, you don't have to work in the hospital. But so I went into ICU and my background too. I just finished my MSN and I'm a family nurse practitioner now, but just doing everything PRN now since we have our company here. So yeah, so Lex and I both have completely different specialties in nursing. That's one of the great things about nursing is that, if you get bored with something, you can go transition into a different specialty of nursing and have a completely different job. Because if I were to go into OR, so surgery, I would have absolutely no idea what I was doing. Or if I was treating any like NICU patient, like a newborn patient, I would have absolutely no idea what I was doing. So if I ever get bored, that would be doing pediatrics, I guess, if that would be something, but definitely not bored yet. So we want to talk about the. So we already talked about what made you decide to be pursuing nursing. So what we want, one of the questions that was popular is, what did you expect going into nursing school? Obviously, a lot of people talk about how difficult nursing school is, but did you so you're a transition from PT? Did you have a expectation of how difficult nursing school was, or did you not really know about it?
I mean, like I feel like everyone's like, "Oh, nursing school is so hard," which I mean, it's not easy.
Yeah,
But I feel like when you're passionate and you're motivated and you have a good support system and you are like organized and like you're just ready to tackle it, and I mean there's some challenges, but I feel like if your head is there and your heart is there, then
yeah.
you can do all the
You
things.
definitely have to be motivated to go into nursing school. You can't just get into it thinking that as like a backup plan or something. I know some people have done that, and then it just kind of, if you don't have your head all the way into nursing school, then you're going to have a hard time because it really does take a lot of mental fortitude, pretty much. You have to be, like Lexi said, extremely organized.
Yeah.
Um,
A good support system.
yeah, you have to have there. I mean,
If you have kids or
yeah,
I mean, especially if you have kids, you
yeah,
definitely need a good support system
yeah.
to
So,
organize all your days.
yeah, so yeah, like with you, obviously you had the. I mean, everyone's story is a little different, but I mean, me going into nursing school, I lived with my parents still. I went, like I said, went to a BSN program and then went back home to an ADN program and lived with my parents. So it was a lot easier for me for someone compared to you who had a child already, and having to take care of them. So everyone's story is a little different, but just shows you that no matter where you're at in life, that
You can
there's
make you can make changes, and I mean there's so much help out there. Like you can just get all the resources and reach out to, people and just, you know, do it for you and your future and your family and um yeah, don't
yeah,
don't give up and think, "Oh, I can't do this because of this." Like just try. There's no reason to not try.
yeah, it's totally worth it.
Yeah.
No matter like all the crap we hear about nursing being terrible job and everything, definitely hospital has that reputation, but it really does depend on what hospital too. Because I worked at a really nice, I didn't really have a terrible experience going through the hospital. I mean, it was definitely hard. There's some days where I just felt like I wanted to quit right then and there, but it is all about what you surround yourself in, and same thing goes through nursing school too. If you have a good support system, and not everyone really has that, but no matter what, you can get through nursing school no matter where you really are in life. It is hard, but if you have the mental fortitude or the motivation to do it, anybody could really do it.
Yeah.
You have to learn how to renew the way you study, and it's kind of a little different that way, but we won't get into all the details. But was there do you believe there's a certain job that you should do before going to nursing school?
No. I don't. I mean, a lot of people say like start in med surge and like,
Now, I mean like a job that before you become a
oh,
nurse.
before you become a nurse? I mean, I feel like there's so many nurses that have come from like I mean, there's nurses that have been in IT before, they've been here, there, wherever. Because, I mean, if you think about it, like figuring out what you want to do for the rest of your life is not that easy. And we all start when we're young. I mean, right out of high school, we're like, what, 18 years old?
Yeah,
So, like, your mind is young, you have different mindsets. And I feel like figuring out what you want to do when you're so young is kind of hard because you haven't gone through a lot of like just life. You haven't gone through life, for very
yeah,
long. So I feel like it is hard to figure out what you want to do. And so some people think they know and then they start the job and they're like, "Man, this is not me. I'm not happy. I don't want to do this." And so, quickly they transition into,
yeah,
a different
yeah.
area.
I will say that if you become an STNA, you'll find out real quick if you want to be a nurse or not, because that's kind of giving you a STNA is like entry level of healthcare job. It's really difficult. It's my most difficult job I've ever had. I worked at a med surge floor as an STNA, and if you guys don't already know that, that's very extremely high paced job and you're doing lots and lots of things for the nurses, but it definitely gave me an eye opener of like what to expect to be a nurse because if you don't really know if you're wanting to be a nurse, I mean, if you don't have any other jobs that you're interested in, try being an STNA first and seeing if that's something that will interest you because you'll either hate it or you'll love it, depending on who you are as a person. But STNA definitely helped me understand exactly what to expect for nursing, and they also
Yeah.
like talking to them about how they got through nursing school too. Like you're like I said once again, surround yourself with people that will support, and then if you surround yourself with nurses that are active in the practice, and they'll be able to give you a lot more insight than the normal person would, or just even
Yeah.
asking your nursing school really, because that's not that helpful.
Yeah. And
So
I mean, like, you don't have, like, an STNA, like, you have to go and get a certification. You have to go through, like, classes and stuff like that. But, like, you can get on the job training at a hospital and work as a PCA,
yeah.
and like you're checking blood sugars and doing things like that. But like I did STNA and I worked at a nursing home, and I know a lot of people are like, oh my gosh, nursing home, ew. But I loved it, and obviously it's not for everyone, but there's just something really sweet and special about like waking someone up and doing their hair and getting them dressed for the day, or shaving the men, so they feel fresh and clean on their way to breakfast. Or there's like a lot of like, it's a lot of work, and it's slower pace, and you get a lot more time with like your patients, and you get to truly learn about like their life, and they live there, so you're in their home, taking care of them. So like as an STNA, you can work in a nursing home, you can work in a hospital, and then if you go the PCA route, it's just like on the job training in the hospital.
Yeah.
So,
Yeah, you really don't even you don't need any actual certification to start
yep.
work. You can apply and based off your personality, I think personality is the biggest deal with healthcare. I mean we both feel pretty passionate about that is that you can be extremely smart and know absolutely everything what to do, but if you're a terrible human being or if you don't have a good personality that's likable, you won't be a good nurse because it takes a lot more than just knowing what to do. And nurses are responsible with human lives on their hands, especially in the hospital, of course. And if you're lazy and don't really want to, do good, then you're not going to be a good nurse automatically. So it just depends on the personality. And that doesn't mean that, you're a bad person. It's just, that's why I say if you are an STNA or a PCA before nursing school, you'll find out real quick if this is something that you'll want to pursue. So it's definitely a good thing to do if you don't have already a steady job. So, all right. So, what were your best and worst memories in nursing school?
My best, I just loved being surrounded by people that had like the same goal. And like we were always studying, and we were always going to class, and we were all very like focused and motivated. And I don't know, just it felt really good to share that same feeling and excitement with the same people.
Yeah.
And it gave you a sense of community, and I don't know, I guess. And then I met you, which that's like a whole nother story in
Yeah.
itself. But yeah, the worst, I mean, I don't know. I just like looking back, it's like, wow, all the little things that you had to do to like, make sure that you were at clinical on time, super early in the morning when it was super far away, or organizing like babysitting and organizing when to study. And I mean, there was a lot of like days that were hard, but you just take it one day at a time, and yeah, you just keep on keeping on.
Yeah. Yeah. I mean, best memories, of course, meeting my wife. And then worst memories is I would agree the high pace. There was so much to do all the time in nursing school, whether it's the classes, going to lectures, and then staying ahead of the game with notes and the exams. And they assign like 40 chapters in 1 week, and you have to stay ahead like with your studying and make sure you're actually prepared for each exam. And then all at the same time, you have to pass lab skills. That was definitely I think those are
Yeah,
almost more
those were,
stressful than the tests
yeah.
because lab skill checkoffs were, of course, you guys don't already know if you're not in nursing school, you have a instructor pretty much staring at every little move you do at nursing and when you do a lab skill checkoff. And that was
Mm,
I feel like I was more nervous about those than I was about the actual test because I've always been
yeah.
naturally a good test taker, so I didn't worry too much about that. But like
I mean,
it
everyone's
was.
like, what instructor am I going to get for, this lab check off? Or
Did you ever fail a lab checkoff in school?
maybe.
I don't think I have. I don't
Probably
remember if
not.
I did.
Will was like, okay, he would literally teach people. Like people would come to him and like he would like have a room in the library and he would just go and teach people like on a whiteboard. I was
Yeah.
obviously the one that was like needed to be teached. And yeah, so
Yeah, I was teaching when I was in nursing school, but that also helped me because I feel like if you teach, that's another like study little study tip for some people is like if you know how to teach it to somebody, then you know the content pretty well. So that really helped me. So
yeah.
that was kind of my way of studying too. So um, yeah, but yeah, that was the I wouldn't say nursing school overall. I wouldn't say there's any worse
I
memories.
actually miss nursing school.
Yeah,
Like we were just talking about that. I miss it. It was like you had a community and you went somewhere every day and like you saw people that were I don't know.
yeah.
I miss it a little.
It's because you had such a big purpose.
Yeah.
Like
And you
nursing,
felt like you were going somewhere every day. Like you felt like
yeah.
you had a list of things that you were checking off every day. You felt accomplished for doing the like, so
It was actually kind of fun in a way because
yeah.
I mean, yeah, it's high stress. You get stressed out quite a bit with all the stuff, but like having a goal, there's always a goal in front of your face in nursing school, whether it's the exam, lab skill checkoffs, going to clinical, and just, you're just like a sponge in nursing school. And it was fun because you're, like you just said, as you're around people that are trying to achieve the same thing. You can, nurses kind of have like a dark sense of humor. So it's like there's like a certain style of a human being is, someone who at least wants to aspire being a nurse, or if you already are a nurse, you know that like your nursing friends are, it's pretty fun if you're surrounded around the right people and stuff. So I wouldn't say it was a bad experience. It was like I said, I actually do miss it as well because it was like you have to be kind of, at least I am. I'm proud to be able to say that I was a nurse, or I am a nurse still, and it's because not very many people can really do it. And like knowing that you're going through something that is hard, it was pretty fun, honestly. So okay, so we kind of talked about this already. What There was another question we had, is that what made you more nervous? Clinicals, tests, lab checkoffs, or simulation? I would probably say lab checkoffs were what I was most nervous about.
Yeah.
Dreadful putting on sterile gloves in front of.
Your
That was
hands are
always
sweating and you're like,
the
man.
worst part is putting on sterile gloves right in front of where you're doing your lab skill checkoff because your hands are like sweating and they will not go on. So if that happens to
Or
you,
if you don't know something and you're like
yeah,
trying to act like, "Oh yeah, I knew that." But like, yeah,
yeah.
it's yeah.
One of the things that always helped me too is if I wasn't so sure about something, I would verbally say it out loud in front of them and say that, once I start talking it out, I would actually kind of figure it out
Let's
eventually.
be
What,
real. Every instructor loved Will, so like I'm pretty sure that they were like, "Oh yeah, you're good. You know what you're doing."
but yeah.
Everyone. Yeah.
Uh, well, let's talk about that. There's another question. Was there an instructor in nursing school that was a big role model for you? And if so, what were their qualities? So I feel like I know what your answer is going to be.
Miss Hellman.
Yeah.
Yeah, she was pretty awesome. I think everyone was scared of her, including myself. But
Hopefully
like
she
I feel
watches
like when
this.
you fear someone, like it makes you want to work harder and like know your stuff even more or they it makes you want to be better and do better when you fear someone just like your kids like your kids should fear you as a parent because it sets their standards high and yeah, so I feel like Miss Hellman just had she was very smart and consistent and
Yeah.
she had high expectations for you and she expected you to know your
It's
your your beep and yeah, I love that about her and she was very professional and yeah, I mean she was
Yeah, I
great.
agree. Miss Holman was very, very smart. I didn't have her as a clinical instructor, unfortunately, like you did, so I didn't really get that much one-on-one with her. But she was like I did have her for a few times in lab skill checkoffs, and she was always very, very knowledgeable. And yeah, if you did something wrong, she's going to let you know. And it
And
might
you
not.
won't forget what you did
Yeah,
wrong cuz she will, make sure you know and then
yeah, it was
and
very like to the point. It wasn't like she wasn't sugarcoating anything. So
you're like,
I
"It's
did like that
okay,
about her.
honey. You'll do better." Like,
Yeah,
"No, that was wrong.
yeah.
Why'd you do that?"
She will tell you. I do know that she was very, very good. As for lecturers, or no, actually, I would say I had a lot of experience with crap. Miss Ayersman. Miss Ayersman was very like I had her twice, and she was very good too. So she was
There was another instructor that you
who
like,
I'm trying to. I
Miss
mean, we've had
Miss
quite a few.
Crumb.
Oh yeah,
Okay, I was gonna say that's like your favorite
yeah. I mean, yeah. Probably my favorite nursing instructors was Miss Ayersman and yeah, Miss Crumb. She was awesome.
Yeah.
She was also a lot. She was always there in labs as well. She was a lot of the time. She was checking me off too. She was very good. Okay, so how was it when you graduated and planning for the NCLEX? Do you feel
So,
like, well, I guess my question is, do you feel like it was more stressful than nursing school once you graduated? Because I
um,
think it was.
I mean, yeah, like it's like all your years are like piled into one exam, and
Yeah.
I mean, yeah, you just feel a lot of pressure. But our graduation was not good. Like it was around COVID,
Yeah.
and like we didn't get a pinning ceremony. We didn't get to do it. Like I'm like, did we even graduate? I didn't feel like we
I did
graduated
not.
because you look forward to like your pinning ceremony and graduating, walking across the stage and just having that like celebration. And we had a graduation party together,
Yeah.
but it still was like
It felt so weird.
I still feel like I never graduated.
Yeah.
But
COVID in general, just like,
I know it's
it
sad.
was
It's
the
like,
weirdest thing.
you look forward to those things and
It totally interrupted, and it was hard to get a job as a new grad too. For me, anyways, is because in the hospital setting, they want you to have experience, and then a lot of the residency programs were shut down at that time. So
yeah.
like, you pretty much had no entry of you know, being a new grad nurse. But I got lucky, so thankfully I was able to get in. But that was a rough time. I think NCLEX preparing for the NCLEX was more stressful just because I think it was COVID at that time. I don't know if it would have been as stressful if
We
it
would
wasn't
literally, because you
COVID.
were supposed to wear masks, like you're required to wear a mask during your testing. So we would practice testing with a mask on.
It was just the most ridiculous thing.
Craziness.
It was. Okay, so how did you? I guess one of the other questions is too is how did we prepare for the NCLEX, and what was your opinion?
Questions. Questions, questions, questions.
What do you mean?
Like NCLEX questions.
Oh,
We just did, like, we didn't, I mean, we didn't study content because I mean, we were literally
yeah,
just studying our entire life away. So
that is a huge point. Yeah,
you just do questions and you learn how to answer the questions because there's a certain style, and they try to trick you and blah blah blah. But like, if you know how to answer an NCLEX style question, then you should be pretty good.
yeah. A lot of it's really just being a good test taker, honestly, and all the NCLEX is a huge safety exam. They're pretty much grading you on how safe you're going to be as a nurse, and they have these scaled questions that come through, and it could be you could only be taking 85 questions or 200. I don't remember the max anymore, but it's changed recently with the new gen NCLEX. But I definitely would agree that don't spend a lot of time on. Actually, we probably spent zero time on studying content because that's literally what you did the entire time in nursing school.
Yeah, we just did
um,
questions
yeah, we did lots of
pretty
questions.
much the
I would
whole
do like
time.
100 questions a day, pretty much before, and I would segment the questions out by category. So I would do this day I would do cardiovascular, and if I missed like a bunch of questions on this certain concept, then maybe I would go back and look at my notes
Yeah.
and strengthen my knowledge up on that. But we would use questions. That was like our strength. We would use NCLEX style question banks. So definitely invest in one if you just graduated nursing school. But a lot of nursing schools nowadays will have a lot of them use ATI, which is like another software that nursing schools like to use to help their students pass the NCLEX on the first time. So um, all right, so describe your first job as a new grad nurse, and how prepared did you feel? Do you feel like nursing school prepared you to be a nurse? Yours might be a lot different my answer than mine because of the route
Yeah.
you took. So you go ahead first.
I mean, so I think I did apply to some hospitals, but like we had a kid, so we moved to Texas. We actually took our NCLEX in Texas. We graduated in Ohio, took our NCLEX in Texas. So we moved
Hmm.
to Dallas, and funny story, I was doing Uber. No, I wasn't.
No, you were
I was
doing
doing DoorDash. Yeah, I was
DoorDash.
doing DoorDash.
And I was working at GNC.
Yeah, and he was working at GNC. We were making like no money. Like we were broke. And but we were waiting to take our NCLEX, and like getting that schedule and all that stuff is just like it takes forever.
Yeah,
But yeah,
especially during COVID.
we were real broke. I mean, it was kind of funny. But yeah, so we applied to literally every job because as a new grad, it's kind of hard to get a job unless you like worked as an STNA at a hospital and they know you're taking your NCLEX and like they can get you a job set up. So I mean, I would suggest getting a job as an STNA like while you're in nursing school. So when you graduate, you kind of already
Yeah.
have, an outlet to starting a new job.
Yeah.
But so we moved to Texas. So like we both he worked at a hospital, I worked at a nursing home in Ohio, and they probably both would have hired us, but
Yeah.
we moved. So we had to apply to like a crap ton of jobs. We
It was
applied
hard.
everywhere. Like I almost resorted to doing pediatric home health, which that is like totally not me
Yeah.
because I like kids when we were in pediatric clinicals, I literally cried at the hospital because I'm like,
It was
this
hard.
kid's crying and like I can't help them. But
Yeah.
but yeah, so I got a job at a home health company and home health, home health, people are like, ah, yeah, you're a home health nurse. Eh. But like, oh my gosh, I learned so much. Like I got to do all kinds of skills. Like we did all kinds of things. You do a lot in home health. And a lot of it was wound care. So we did lots of wound vacs and different things like that. But um so yeah, I started out at a home health company and their nurse, their director of nursing was really hands-on with me. Like she went to all these different visits and like taught me how to put like catheters in and wound vacs and IV antibiotics and all the things that like you do at home now. And so I had a really good hands-on nurse that helped me just like transition into like being um being autonomous, like being my own nurse.
Yeah.
Because when you're in the home, like it's just you and the patient.
Yeah.
Like you don't have
You have to
your
be autonomous.
yeah.
Yeah.
Yeah, you don't have your, nurse manager on the floor like, "Hey, I need help with this." Like it's just
Hmm.
you and your phone if you need to call someone.
Yeah.
But yeah, so it was like I learned a lot. Like when you're thrown into like a situation like that, like you just have to be very good at communicating. Like you're constantly communicating, asking questions, making sure if you don't know something, you figure it out before you go into the home. Like there's a lot of like just I mean, just with any new job, like you're just like learning a lot. So I don't know. I feel like I learned a lot, and I did enjoy my job. Um, and you have to kind of like work the system a little bit to get to where you want to be with like money wise. So like the home health, we did a lot of wound care. So I was like, oh my gosh, I love wound care. I would have never thought about that when I was in nursing school. And so that's where I started working for a hospital system, and now I do outpatient wound care. But yeah, I feel like my first job kind of helped me to learn like really what I liked and you know what I wanted to do, and then
Yeah.
you just kind of build off of that. But you
Yeah.
have to find a good job that's willing to train you really good and make you feel comfortable to be autonomous and do all the things that and learn all the things that you need to.
Yeah. So yeah, I would agree that the home health would be a really good job. I actually did home health as a nurse aide, and you really do have to kind of, you have to be, autonomous. And me going into emergency department, so I got lucky. So a lot of new nurses, they have a hard time transitioning to practice because nursing school, that a lot of the clinical rotations, many nursing schools don't really give you a lot of hands-on practice and really know what to expect. You're kind of just shadowing a nurse most of the time. You do skills here and there, but that was my experience with our nursing clinicals before I got lucky enough to get into their. They had some kind of program in our nursing school that they chose like 10, I don't remember, 10 students, and I was luckily one of them. So I got put into a night shift emergency department residency, or not residency, it was emergency
Yeah.
department clinical rotation. But they, I got so much hands on. I didn't believe I would ever get that much hands on before I actually became a nurse, but it was a huge deal. Like I was putting IVs in all the time, Foley catheters, like on demand. Like I didn't like clinical rotation. I maybe put in. I don't even think I ever did a Foley catheter IV or anything before this. No, seriously, I don't think I
You
have.
did?
No, before or maybe we had a rotation year, but I don't even think I did very many. So
Oh, I thought
I
you
can't
did.
remember what I did at that. A lot of the time we
You
had
had an
this.
oncology.
So we had a clinical rotation together. It was our last one before I had, like, it was our second to last one. And we went to the smallest rinky-dink hospital ever, and we had grandmas that fell down, like, splint their toe or something like that. And we had no critical care, no like clinical skills. We were just doing like pretty much CNA or nurse aid type stuff. But like I don't remember now. But I may have done a few like skills here and there, but nevertheless, I was doing like multiple in this emergency department clinical rotation I had for my last semester, and it really helped a lot. So I don't, I got lucky. I can see the new grads that I worked with when I had at this time I had 2 years of experience working in the neurotrauma ICU. A lot of them have a really hard time because this is their first introduction of being a nurse, and they're learning skills that like as they're learning all the critical thinking that's involved, and it can definitely be overwhelming. I mean, it was still a little overwhelming for me as getting into critical care right away, but I definitely felt like I transitioned pretty well just because of that clinical rotation because I didn't have to worry about if I knew how to do clinical skills like IV insertions, Foley catheters, you know, NG tube insertions. I've done like probably close to hundreds of them before I even got to the bedside at working as a real nurse. So I got really lucky. So, but I definitely feel like their hospital systems. This is what I'll say is you really have to be strong on what you want as a person because these hospital systems will take you in as a new grad and you'll be immersed into like this completely unsupportive environment. This happens all the time. There's hospital systems that are either really good or really bad. And if you're going to be put in a really bad one, which you may or may not, you have to just realize that this is not how it's like everywhere else. Please leave. Like you don't want to be just they'll like pretty much throw you in a cage and say you have to stay here. They'll try to sign all these new grads. They'll make you try to sign a contract. You have to stay for the X amount of years and all that. I would highly suggest you look really close into that because they do this all the time. You want to make sure you have an outing if it's a terrible environment. If you don't have people that are supporting you, there's plenty of hospitals that are very supportive. You need to find that hospital, especially if you're having a hard time. Now, it just depends on where you're at. So if you
Yeah.
had an experience like me, maybe that doesn't matter as much if you're in a
Yeah.
terrible hospital or first job, whatever. Because I definitely wasn't in my first nursing job. Definitely wasn't that supportive. But then I went into the neuro ICU,
Yeah, I
and it was
feel like
very supportive.
yeah, I
So
feel like you don't know a lot as a new grad. Like you don't really know how much you're supposed to get paid. You don't like
yeah,
there's like little things that you really don't know because obviously if you go from working DoorDash or GNC, like if you're starting out
minimum
making
wage.
X amount of money, like any increase in pay, you're like, "Oh my gosh, this is great." But like talk to other people, like talk to other people in your field, talk to
Yeah.
people that
Oh yeah.
have been in your field for a lot longer and get their advice like, "Hey, what do you think about this?" or "Hey, what do you think about this?" Cuz I had a lady that I talked to very closely on my first nursing job, and she was like, "Oh no, like they're taking advantage of you. Like you're doing all these things, like they're taking advantage of you." And I'm like, "Oh my gosh, I didn't even know." And that's why I got out of there. But yeah, it's like I was like, "Oh my gosh, I did not know I was getting taken advantage of." And once you stick up for yourself, like you get stronger and you just keep building and building and then you get to where you want to be and you fight for yourself because no one else will do it for you and getting that support and the just the advice and information from people that have been in your field for a long time like is so golden.
Yeah. You have to. You really don't give up on finding the right place. I mean, like I said, a
It
lot of
took me 2
people.
years to find where I work now, and
Yeah.
I'm telling you, it is amazing. I love my job. I love to go to work. I love it. I love the people I work with. I love to go to work. I mean, it when you love where you work, your home life changes too. Like if you're always stressed at work and you come home, you're like, I'm stressed. I want to
Yeah.
go to bed. I don't feel like making dinner.
Yeah.
But yeah, you have to love where you work because you spend most of your time there. Like you work full time. If you're spending 40 hours a week there, like that is
It's a lot
most
of
of your
time.
life. Like you need to love what you do, love where you work. You worked very hard to get,
Yeah.
the degree that you have. Like you need to stand up for yourself and
Yeah, that's a message that a lot of people need to hear is that as soon as you pass that NCLEX, you have an RN behind your name, you're qualified already. You don't have to sign yourself up for a 2-year contract and be, taking control over a healthcare system that, treats you like trash. So if you're in a bad environment, get out because it's not like that everywhere else. That's not healthcare overall. And let's talk about pay because a lot of them will try to encourage, not just nurses, but a lot of professions is that I think pay transparency is becoming more of a more welcome thing, because the olden days that, a lot of, even like our parents and stuff, that was like a frowned upon thing. You don't share how much you make and all that stuff. But like pay transparency, if you have a good support group around you, you're qualified right away. It doesn't really matter how much experience. Now, some people may argue that if you're loyal to a healthcare system, it does matter. If you're there for like 10 plus years, you should be getting, much more pay than everybody else around you. Loyalty, of course, counts. And of course, your experience, like, a 2 year nurse should get paid more than a new grad nurse. But what I'm saying is that don't be afraid to ask about, if, of course, if it's okay, you can ask them if it's okay how much you get paid. Because really, we both climbed up the ladder very fast just because of that. Because I
Yeah.
wasn't afraid of, asking my peers how much they made, and, how do I get to that point? Because, and here's another thing, like they act like nurses aren't allowed to, want to work for money. That's another thing. They're like pretty much gaslighting nurses for, being in a profession for money, which is hilarious because nursing is just another job. It really is, in my
Don't
opinion.
tell me that a McDonald's worker can make close to what a nurse in the hospital makes, because
Yeah,
that is
it's
ridiculous.
ridiculous. Yeah, so that's why I'm
You
saying. That's why I always say, like, you're qualified immediately when you get that RN, because not very many people can even get that. So don't be, you know, letting a healthcare system control what you're qualified, what you deserve to be paid.
Mhm.
So definitely look into that when you're looking into a new job as well, because yes, experience matters. You're supposed to get paid more when the more experience you get, but definitely don't feel like you have to take a pay cut. There's some people that are taking pay cuts, off their previous jobs, depending if they came from a different industry, But nurses they deserve to get paid more for sure, and the pay transparency needs to come out, and nurses don't need to be gaslit up to believe that they should not be working for money. They should be working because that's what they love to do. Yeah, we love to do it, but it's also a job, so it pays for your livelihood. So
Yeah.
don't think that healthcare systems are gonna, uh, you know, give you the pay that you
Mhm.
deserve without asking for it. So, all right. So the last thing we're gonna talk about, guys, is what is your favorite thing about nursing, and what is your least favorite thing from your experience so far. So, do you want to start or me?
I can start.
So, what's your
My
favorite and least favorite?
my most favoriteest thing is I love old people, and I love old people. Like there's just something really special about them that like my heart twinkles. And I worked in a nursing home, and like they're my grandma and grandpa's, like I love them with all my heart. And uh yeah, so I love the relationship side of things. I love making people feel like loved and comforted, and like you're closing a loop. Like, so a lot of people, like especially like a new patient, if we get a new patient in, um they're skeptical. Like they come in with questions, they're skeptical, you have to earn their trust, and you have to earn them feeling comfortable and supported, and like they're in good hands. And I love that. Like I love making people feel like they're in a good place, that they're going to get really good care, that they're supported, and like we truly love what we do. Like I want you to feel that when you leave. Like if you come in scared, you are going to leave the clinic like happy, like, oh my gosh, I'm so happy that I'm here, I'm so happy that I'm getting this care. And I'm telling you, like, that feeling of making someone come in that feels scared, and like this is going to be the worst day, or whatever, when they leave and they give you a hug, or they say thank you so much, or like that they express to you that they feel comforted, loved, and supported, and like they're in good hands, like there is nothing better than that. Like I
Yeah,
love that.
I agree.
It's the best thing ever. It's like, man, this is why I'm doing this. And then you have the other side. One thing I don't like is the other side of people, where they're expect, like, they expect you, like, oh, this is your job, then do it. And
Yeah,
I don't care that you love me and support me, like just do it. I don't care. You're this is your job, you're supposed to be doing this, and they're not appreciative
yeah,
of what you're doing for them. And they expect things, and they talk down on you, and blah blah blah. So there is that side of things. But I mean, honestly, like, that doesn't, like, that's just our society these days.
yeah. You're gonna see
People are just
bad people
expect
everywhere.
things,
Yeah,
and they think everyone owes them and blah blah blah. And you're gonna see that in healthcare, of
Oh
course.
yeah.
And you just are like,
Yeah. I
so,
totally
and
agree.
and you treat them the same. Like you consistently give
Yeah.
them the same love and care, and sometimes they switch on you and they're like, I love you now. And you're like, hi, and then next week, but yeah,
Yeah.
definitely like the relationship side of things and just the emotional side of things.
Yeah. Yep, I would totally agree. So just like anything else in the world, that you're going to see the good, the bad, and the ugly type of people out there. Nursing is just a little elevated because, well, at least in my environment, I worked in ICU, and a lot of times it wasn't even the patient, it was the family, because
Hmm.
these people are going through the worst time of their lives, most likely. They're the highest
Yeah.
stressed, and these people were just quick to get angry at everything, quick to question, and you have to be really good at customer service basically in the ICU, because yes, you have to be extremely skilled, you have to know your crap, but also you have to be extremely good at de-escalating, because it's not just the patients, it's the families that are coming in after you, and they will go after you. You have to have kind of like a chip on your shoulder a little bit. But I agree, the best thing about nursing, by far, is you go in, especially ICU, they come in from the ED, they're anxious as crap, they don't know what's going on a lot of times, especially in the neuro unit, they're already confused. But you go in, they're doing a mission, and then they just like their mood just changes completely because of how you are as a person. And that's where we go off of, like, you have to be a good person to be a good
You have to
nurse.
be genuine.
You
Like
have to be, yeah.
you
It's
can't be a fake good person. Like you truly have to be genuine and believe in your heart like that's who you truly are
yeah.
because it shows people can read between the lines.
And it makes your life so much easier as a nurse, because
Yeah.
if you have a cooperative patient, you're going to have a great day. Like, it's just really how it is. Those patients can be as hard as they want on you, especially in the ICU. Is it's not just vital signs, blah blah blah. It's the neediness. You're taking care of the neediest human beings in the world. Physically, not just like emotionally, but of course that's going to come when they have a physical problem. But physically, you're not just treating like the emotions. You're treating them physically throughout the entire process. So these people are difficult to care for. But if you love your job and you're really good at making people feel good, you're gonna like your job, and it's gonna make you feel good. Just inherently, I feel like humans in general like feel good by doing
Hmm.
good. So that
And
was
it
one thing
helps
I
your
love
health.
doing.
And
I
it's good for your health.
yeah, I love going in, and like although like overall hospital work is extremely hard, but I did love like getting new admissions. Hated admissions, but I loved the part of getting that patient in there, and I made them feel like so much better about what's going on. I
You're the
educated
first
them.
person they saw
I'm
on
the
the
first
floor
person
and
that they saw. Yeah, they're
you
they're
set the
asking
tone
lots of
for their.
questions, and I do you set the tone for how their
Mhm.
experience is going to be, and you see it in their eyes, like it just completely changes. So that
Yeah.
was definitely, I agree completely. And then yeah, worst thing is dealing with people that try to make like you're just a service worker for them, and blah blah blah, and just like everything else. But nursing is just definitely elevated to the point, because you want respect as a nurse. That's number one thing you'll find out, is like your job does deserve respect, and a lot of people don't know what nurses really do. They think like nurses like wipe butts all day, but we are literally, if it weren't for, if you could actually, I would argue this might be a little controversial, but if you were to choose a nurse or a doctor to come in and save your life, the doctor's going to know what to do. They'll know everything what to do, but are they going to be able to actually do it? Like, do they know how to deliver a lot of the healthcare? So like doctors aren't necessarily trained on how to safely give medications, how to put IVs in. A lot of them don't really know how to put IVs in. But I'm saying a doctor, you need a doctor, of course, but if there is one lone standing healthcare worker that you needed to save your life, I would argue it's the nurse, because the nurses know how to save your life the safe way without killing you. What's the number one killer in America in the hospitals? Medical errors. So I'd say, we do deserve respect. So that just kind of ends on our podcast here. We got to get going. So our next podcast in the clinical break room will be actually my dad. Ironically, is my dad is a clinical, uh, what is he? A clinical drug and alcohol therapist.
He has like two PhDs. He's the best person in the whole
And he
world.
has the it sounds silly that we're talking about this, but he has the best stories about his life and what he's done. He's also
He
been a preacher for many years, and he
he opened an
actually,
orphanage in India
yeah, he opened
that's
an orphanage
still.
in India that's still running today. So we're going to talk about that. He
Mhm.
spent many years in India, He has a lot of crazy stories about
His
that. So,
yeah, it's
um,
very interesting. One of his first kids that graduated from their program in India is he's a
yeah,
neurosurgeon or he's a cardiac
yeah,
or
he's
cardiothoracic
a
surgeon
cardiac, yeah.
in Oregon or something.
See, like that's yeah. See,
It's cool.
it. So he's made a huge difference in a lot of people's lives, and it's his stories are always really funny and
He doesn't ever like he only tell you if you ask. Like
yeah,
he's very like he doesn't even tell people about his degrees or like people could be calling him Dr. Kirkpatrick and like no one calls him that. Like he is the most humble person
yeah,
that you'll ever meet. And when he makes lasagna, I'll sit at the kitchen and I'll ask him
yeah.
every
Lexi knows more
I
about my
ask
dad than I
him,
do.
yeah, I know more about Will's dad than he knows about his own dad. Because I would just sit there and be like, so tell me another story,
He has
like
unlimited stories, so
yeah,
we're gonna get deep
yeah.
into understanding like his life experiences because it definitely is. It makes you kind of stop and think how amazing,
Lucky we are in the
yeah,
US and
how lucky
how
we are and how amazing.
unappreciative people are
Yeah,
about, you know, everything.
yeah.
The
All
simple
right.
things.
Well, thank you guys for watching. We'll see you guys in the next video.
Bye.